Well, hello, and thank you everyone for joining us for this, our fourth Fireside Chat as part of the Impact and Learning series from the Power of Nutrition. And we've been conducting this Impact and Learning series because it's a 10-year anniversary of the Power of Nutrition. For a decade now, we've been working with partners to deliver large-scale, system-strengthening, sustainable programs across Africa and Asia. And we've only done that through the power of partnerships. So I'm delighted to have with me today Sam McIntosh from the End Fund. Sam is joining us to talk about a partnership that we've been running since 2021 in Ethiopia. But Sam, why don't you just introduce yourself and give a bit about your context of being here today?
Thank you, Shelley. It's a real pleasure to be with you. I'm Sam McIntosh. I'm the Vice President of Global Strategic Partnerships at the End Fund. The End Fund is a vehicle for private philanthropic investment in the NTD sector, the neglected tropical diseases sector. And so your viewers may be wondering that I haven't said the word nutrition yet, and so why we're speaking together, and we'll get to that very soon. But essentially, I think we share a lot of very similar traits in terms of our organizations. And one of those is that leverage is really in our DNA and has been. The End Fund is just a few years older than Power of Nutrition. We were established in 2012, but we were really established based on a principle that philanthropic investment to treat neglected diseases such as parasitic worms can be that investment can really be expanded. It can go so much further through the right partnerships and with the right kinds of leverage. And that can only be achieved by working with the right types of institutions. We work on a problem that is a 1.6 billion people-sized problem. So that's the number of people every year who currently need to be reached with treatment for NTDs. And we can only do that in partnership. There is no one organization, one entity who can reach a scale like that around the world. 40% of that burden is in Africa alone. And so we need to continue to find new types of partnerships in order to be able to operate at the scale of that kind of problem.
Thanks, Sam. Yeah, it's a huge problem when you look at the stats relating to malnutrition and tropical disease and neglected tropical diseases as well. It's huge. And I think this is why the partnership we came together on in 2021. So it's a $30 million partnership that was convened by the Power of Nutrition, bringing together the End Fund with the Eleanor Crook Foundation and Rotary International with funding from the UK government to look at how do you actually bring those partnerships together to really make the change that you're talking about. And that partnership was built off the back of really impressive strides by the government of Ethiopia, setting up the Sokoto Declaration with an ambition that by 2030 they would eradicate stunting in children under 2 years of age. So our programme was built off the back of that, and we're delighted and very proud to work with the government of Ethiopia in that endeavour to really escalate efforts. And we attempted to bring together these funders that wouldn't normally necessarily all be funding nutrition, but having different objectives, having different focus areas, but like you say, with very similar kind of overlap. So what was it about that partnership that you think brought the End Fund into it? What was the trigger?
Well, I think there's a few things. The first is that all the organizations you mentioned, we have a shared vision for the kind of health outcomes that we look to support and create through the investments that we bring into the health sector. We have a shared philosophy on how to collaborate with others. In terms of our communication, our transparency, our collaboration, the humility, I think, that goes into that type of collaboration is really important. And again, I come back to the shared commitment about leverage and understanding, really believing in and investing in the idea that we can do more together than apart. And I think for a very long time, facets of the global health community have been operating in silos when that is not necessarily aligned with the vision or even the infrastructure of an endemic country's health system. And we've been able to do that at times when funding has been more abundant, but at times when it is less so, it's even more important to look beyond the silos that we traditionally have operated in and think about how to come together with new partners. So critical to that is identifying shared vision, shared overlap, and shared goals, and understanding each of our unique assets and contributions that we can bring to a partnership. And so for the end fund to be able to leverage the funding from Power of Nutrition and the other organizations you mentioned in support of the leadership from the Ethiopian government was a tremendous opportunity because, as I said before, the scale of the challenge posed by NTDs, and in this case of our partnerships, parasitic worms specifically, is extremely hard for one organization, even one sector, to tackle effectively on its own. And certainly, and I'm sure we'll get into this, but when you look at the calculations around the cost benefit around tackling diseases or solving nutritional problems, oftentimes it's, I think we all come up with these kinds of figures. For every dollar invested, you can achieve a X dollar. Often it's more than $20, $25 in return. But I think those kinds of returns and that kind of value for money can only be achieved if we're looking at supporting communities in a holistic way, because of course you can provide all the nutritional interventions you want, but if the people you're serving have a belly full of parasitic worms who are going to steal those nutrients, those investments are going to be suboptimal. And similarly, if you invest in deworming programs, those are only going to go as far and be as impactful in terms of long-term health outcomes if malnutrition remains an issue. And so I think looking at our co-investments in a holistic manner was one of the most important and exciting opportunities for us through this partnership.
Yeah, I love what you brought out there, particularly I think about the leverage, because what we've been able to see is we've been able to reach over 1.2 million children with vitamin A supplementation, alongside also being able to give them deworming treatment. Alongside 400,000 mothers in that context being able to receive micronutrient supplements. So I think that actually ability to recognise where the financial return comes from, because normally those would be siloed programmes that would be doing their own thing, yet instead when a mother comes to the clinic, she's able to do, three things in one. She's able to, get the advice on how to get a good diet for her child. She's able to get deworming treatment for her child. She's able to get, the other vitamin A supplementation and plus other health interventions alongside. So that collaborative bringing the partners together, I think, is the really key thing that we've been able to see here. And we don't know how far otherwise, though, we've reached that number, but how far would it otherwise have been able to go had we not come together in partnership? And I think a key part of this has been how we've been able to work with the government of Ethiopia, who have also been very supportive of a piece of research alongside this, funded by Eleanor Crook Foundation, looking at the right responses to acute malnutrition and the dosage, and that ongoing piece of research for us right now has been really supportive in working in partnership with the government there. And so just thinking about that, working with the local governments, what do you think is really important in ensuring that we do that effectively?
Well, you've said it, Shelley. A big part of it is, the central part is putting governments first. Mm-hmm. I think when I come back to the idea of the shared values that we've talked about a lot in our partnership, it is a relentless and a passionate focus on maintaining a supporting role. Mm-hmm. At no point does the Power of Nutrition, the End Fund, or any of the organizations we're working with on this project put ourselves in the driving seat. We are support to a very progressive government who best represents the needs and the opportunities to serve the communities that it represents. And so for us, always maintaining that focus, that we are in a supporting role and that we can actually help to evolve the nature of the support that we provide to government as they need it, as they ask for it. I think you've talked a little bit about Ethiopia and their leadership, and looking at the scale of the health system in the country, looking at the variety of different challenges that the Ethiopian government is trying to overcome through the health system. One of the most encouraging and biggest investment opportunities, I think, has been supporting how that leadership has evolved based on a response to the external environment. And so at the moment, we are seeing a huge amount of focus on finding efficiencies, finding opportunities to co-deliver programs to the same communities. Looking at the health campaign effectiveness is a big area of work that Ethiopia has really been leading on across the continent. And so that is finding opportunities, finding synergies, which in turn can be turned into investment propositions, if you like. And so that then becomes part of the work that we can do, is to help crowd in resources in service of that leadership from government, but it's based around what government's policies are, what their strategic plans look like at any given time, and having the flexibility and the humility to come together to serve those goals, but also to evolve as we need to, based on what the government is asking of us.
Yeah, couldn't agree more. I think it's that support role and championing role that becomes really important, doesn't it? And I think we've both got something about strategic partnerships in our job titles. Tell me more about what you do, what your aim is in the sort of strategic partnerships area to facilitate all of this that we're talking about. How do you make that work?
Well, in some ways it's relatively straightforward, and in other ways it's complex. To begin with, the model of the end fund, we raise philanthropic capital, we pool that capital, and we pair it with other investments such as drugs that have been donated. In the NTD sector, we are extremely fortunate to have as a keystone to the program delivery globally a drug donation program. So pharmaceutical companies have extremely generously come together to donate, in some cases, as much as is needed for as long as is needed until NTDs are actually eliminated. And so this offers, we've talked about leverage already, this offers a tremendous amount of leverage. In any program delivery, the cost of the drug, the materials being provided are often one of the biggest unit costs. And so that's immediately taken off the table, ensuring that any philanthropic investment goes even further. And so a big part of the work that I do around strategic partnerships is strengthening and deepening the trust with those co-investors in the pharmaceutical industry. Over years, we have seen hundreds of millions and now billions of treatment billions of tablets and treatments provided. And that offers a tremendous opportunity for the philanthropists that we bring to the table. So at the same time, we need to be not just fundraising, we need to be thinking about which particular drugs need to be delivered in which places, over which frequency, through which partners. And so our operational model requires a constant set of connections and relationships and trust across government, across implementation partners, across philanthropists and other donors to the space, and the co-investors that we have in the pharmaceutical industry. But as I said before, all of these stakeholders need to come together in service of the governments who we support. And so a key part of the work that I do in strategic partnerships is helping to evaluate that ecosystem of relationships, invest in deepening certain relationships in order to help maintain that balance, in order to help celebrate the commitment of various stakeholders, and ultimately crowd in more resources to support the advancement of disease elimination. So that's perhaps the more complex piece of the answer. But I think a really important element of that is thinking about identifying new types of partners. And for us, as I said before, moving out of the silo of the NTD sector and the traditional stakeholders that we work with to identify and discuss with new types of partners, such as the Power of Nutrition, who operate in other sectors but who have shared goals. We identify that we're working at the same time to treat and provide services to the same communities, oftentimes through similar platforms at similar times of year. And so the opportunities to explore natural synergies are already there. And a big part of the job of strategic partnerships is unearthing those opportunities, bringing them to light at the right moment, and creating the right motivations for perhaps unlikely partners to be able to come together around a common cause.
I really like two things that you said there, Sam, about the ecosystem of relationships being really important, but also the consideration of motivations. Because I think so often we can get caught up in the things that we're trying to fund and forget the motivations behind the funders. And so to actually begin to have a common language and to start talking the language quite often of the private sector or whichever type of donor you might be talking to understand their language, to understand their motivations, and to begin to build those synergies is the strategic partnerships bit that I've been involved with the Power of Nutrition and elsewhere. And I think for us as well, it's as you've been saying, it's how do we find funders that are outside the box? You know, like you started off saying, the End Fund didn't typically fund nutrition, but it's good to come into a partnership where the deworming gets addressed in Ethiopia alongside the nutrition interventions, alongside the support we get from Rotary International in terms of volunteer support on the ground, which they're so great at. And I think we've seen that over so many of our partnerships where they have different focus areas, but where we can see the long-term gain and the long-term benefit of working in partnership together, we really then begin to see change happen at the scale we need, but also in that sustainable, system strengthening approach that we've been talking about. So that ecosystem of partnerships and relationships you were talking about can be anything, can't it? From governments to funders to local communities to healthcare professionals to, it's right across the board. And I think navigating those different motivations and what people are interested in, but what they're passionate about, I think is probably a big part of this. Yeah.
Absolutely. And I think that's one of the core elements of our operational model. As a fund, a philanthropic fund, we create a platform, a space for donors to come together, in part because they recognize that pooling their investments can have an outsized impact rather than just investing themselves directly. But there's a second element to this, which is really important, and it's the learning journey. It's the culture, it's the opportunity for donors to learn together, to learn from each other, to perhaps even challenge each other in a safe and constructive space, to be able to really push the boundaries of what is possible. And I think that's where organizations like the Power of Nutrition and the End Fund have a really important role and perhaps even an obligation to help to ensure that as those learning journeys happen and as those conversations and the sparks that can come out of those conversations amongst donors happen, that we maintain the goals of government at the center of those conversations. And if we can do that job well, and if we can create that environment for donors and other stakeholders to learn and to come together in new ways and to enjoy the experience of giving, then I think we can really have an outsized impact in that way too.
Yes, being connectors, I love that, and learning together is so important, isn't it? Because you're in danger of cycling the same issues over and over again unless we really learn from what others are doing. And that's what we've been trying to do with the Impact and Learning series with the Power of Nutrition. This is 10 years of what we've learned, and share that with the sector and say, these are the things that have worked well, these are the things that have not maybe worked so well, and to build on that. But as we sort of come to the end of our time, Sam, if there was one thing that you would really encourage others in the sector to consider about the power of partnerships, what would that one thing be?
It's hard to boil it down to one thing. I've talked a lot already in our conversation about the importance of centering governments and centering communities. That has to be part of the answer. But I think in order to find the right way to do that whilst maintaining creativity, maintaining trusted relationships that allow the space to ask questions and poke holes and explore new ideas in a truly trusted way that doesn't come across as negative or suggesting a different approach, but actually is coming from a position of wanting to be able to try to do more and contribute more. I think that trust is very difficult to articulate because the nature of what goes into that differs from relationship to relationship, but you know it when you have it. And I think that has to be a absolutely crucial part of what I would love to see echoing across the global health sector.
Yeah, tailoring, definitely. That's so important. Sam, thank you so much. It's been great to have a chat with you as always. Really appreciate your time, and please look out for more that's coming out from our Impact and Learning series so that we can keep learning from each other. But really appreciate you taking the time today. Thank you.
You're most welcome. Thank you very much.